So my name is Dr. Caitlyn Hoffman. I'm a pediatric neurosurgeon at Weill Cornell in Manhattan. So my focus is primarily epilepsy surgery. And we are primarily working to advance the minimally invasive approaches to epilepsy. So potentially the use of deep brain stimulation for epilepsy, hoping to move towards the use of focused ultrasound for treating epilepsy for patients that currently now are not surgical candidates.
Okay. People like me. So tell me about your talk today. What did you talk about?
So my
and
talk,
what were the questions that the audience asked?
Yeah. So my talk was on the way in which we go about determining who is a surgical candidate. So what that road looks like, what that process looks like, so that parents can be prepared for it, can start to interpret the data on their own, understand the reason for all these tests, what it means for their child, and what that data looks like and how those determinations are made. What does it mean to be a surgical candidate? Why do we say some patients aren't? Although that definition's changing every minute, and that's what I also spoke about, was all of these new initiatives that are really, really changing that definition of lack of surgical candidacy. Okay, we're really expanding the umbrella of who fits under or within the realm of surgical candidacy. And so we reviewed what that road and process looks like, the tools that we have, and how those are expanding. Parents mostly were just asking for further interpretation as to very practical questions, which is good in terms of, my child needs sedation for every scan. How is that going to make them a candidate or not for part of this workup? For a PET scan, for a SPECT scan, is that really going to work? How does that change the output? I mean, very sophisticated questions, which is important. It tells you how much this consumes patients and their parents' lives, that they really have a very complex understanding of all of these steps.
So things like a prolonged EEG, which I know can be very uncomfortable.
Correct.
For 1 week, or let alone 2 weeks as well.
Yes.
I know how to cope with MRIs as an adult.
Right.
But yes, they can be quite scary for children.
Yeah, with children it's a whole different issue. And then we have to get into, if we're sedating that child to obtain the information, often the types of sedating agents that we're using suppress the seizures. So then we're eliminating the data that we're trying to achieve. So it's a very interesting question. It's something that we do have to work around, and there's certain tests that respond less to it, but it's an important question.
So what type of questions did the audience here at Epilepsy Awareness Day ask you?
In addition to the question about sedation, just in terms of providing further clarification as to the utilization of the newer tools that I was introducing and whether they applied to more generalized epilepsy, focal epilepsy, really wanting to hone in on the applicability of these tools, as is common, because there's a lot of enthusiasm and they're really still only applicable to a certain subcategory, of course, but so a lot of just discussion about the practical aspects of those evolving technologies.
So now tell me about why it's really important to bring epilepsy out of the shadows. And that's obviously, it's all about stigma.
Yeah.
So tell me about why it's really important.
So what's the most important in what I do and why I decided to be a pediatric neurosurgeon and focus on pediatric epilepsy is because, for this precise reason, which is that once seizures are allowed to continue to the point where children and then adults are refractory to medications, seizures have gone on their whole lives, and especially when they begin in childhood, it affects their cognitive development, their motor development, their language development, and if only it were able to be intervened upon sooner, they actually have a chance at experiencing normal development and a much more normal life. So for me, that is why I am very passionate about early intervention, bringing all of these patients to awareness and assessment much sooner, to give them a shot at much more normalcy.
Better life. Okay. So what happens if you have parents who don't like epilepsy and they'll hide it away from their child, and also other people as well? So that means their child becomes isolated. What happens in that sort of situation when you have a child who comes to you, and is there any precautions that you have to deal with any parents or extended family?
Yeah, it's unfortunately because of within the world of pediatrics, they're essentially at they'll only really come to medical attention if they're brought by their parents. So it's one of those things that we just unfortunately end up seeing potentially, the children a bit too late or later than we would have preferred in terms of providing them with better quality of life. But again, there's very little that we can do at that point because they really just present when parents decide to present, and it's variable. And we do deal quite commonly with patients that will present with a child who's clearly having seizures, but the parents are really, really uncomfortable with the diagnosis and therefore don't want to accept the necessary treatment. And so I really think that at the end of the day, it just comes down to consistent education, developing a relationship with families so that there's mutual trust, carrying them through some of the non-invasive, less scary aspects of a workup, and just building on that to the point where then maybe they can understand what their child ultimately needs. And we go through that constantly in pediatrics, but it's a process.
So yes, it's and you get a lot of children through your clinics, and they are really grateful for what you're doing and trying to help them. So you said to me you have 14-year-olds and teenagers. Is there anyone?
I treat from birth to adulthood.
Okay.
I treat
so
everyone.
What is the knowledge like for children who do they understand epilepsy and what they have themselves?
Oh, absolutely. Children often have a better understanding than adults. They're very sophisticated because they've had to live with it and they've been asked to live with it from as long as they can remember. So they actually have a bit of a more developed emotional sophistication about it.
Okay.
You'd be surprised.
So they can tell you what's going on directly with
yes.
them? Okay. So that's a really good thing. So they're telling you a lot about it. So if it's about the stigma side, do they tell you if they're telling their friends about their living with epilepsy?
It's interesting. I mean, I think that depends on so many different factors that have to do with what's their social environment like, what's their school environment like. So I don't know directly the answer to that question. But
okay.
It's interesting.
Yeah. Okay, so my last question is, what would you say to people and to children about coming to Epilepsy Awareness Day, and why should they come?
I think it's a tremendous forum for everyone. It's a tremendous forum for patients, for providers, for industry, because it's a collaboration. Everyone here is learning from each other. I'm learning from not only industry, my colleagues, but every patient that comes by to ask me a question I hadn't necessarily maybe thought about. It really teaches you a lot about different directions that we should take all of our own individual endeavors, but it's also a forum in which people can come and realize that there are a lot of people in the same situation. It's okay to ask all these questions. It's all right to gain all this information and really, dig their heels into what it means to explore this, diagnose it, what do we need for treatment. And sometimes that's very hard to get over that hurdle. So this provides a really wonderfully active, safe environment to explore all of these options and see how many other people are going through just the same thing, which I think is really important.
Yeah. Okay. Thank you for talking to me.
Thank you.